Good afternoon, Elias Thomas, and welcome to On the Radio News Bulletin.
Hi, thank you for having me. I actually decided to join your team and chat to you about what's happening at the moment.
Sure. Now, the Ministry of Health and Social Services has recently procured 36 ambulances. And on top of that, the ministry plans or has a thoughts of introducing 5G and AI technology. Now, what are your thoughts on the ministry's plan to introduce smart ambulances equipped with 5G and AI technology? Is it something that is feasible or just a dream?
I think kudos to the ministry for obviously acquiring that many ambulances. I think that's something good for the service and just for the needs of the people of the country in general. But I think in terms when it comes to AI, I'm not really sure as to how you integrate AI into this ambulance services. I think as I've seen, I've worked everywhere in the world, pretty much in the UK, in the Australasian regions, in the Middle East. And I know that they are integrating AI into their systems, but it's very minimal, like maybe perhaps call dispatching, perhaps, when it comes to when you prioritize your calls.
Yeah.
There's a well set, solid foundation as to how the ambulance service operates. So you can't just integrate AI. You need to start with the basics. You need to start with just having a call center. How about if I have an emergency, there's a number that I call and an ambulance can get to me in 10 minutes. How about we focus on those things instead of focusing on AI and integrating augmented reality, for instance?
Mm. What challenges do you foresee with integrating technology like augmented reality into paramedics' day to day operations?
I think you need to understand who operates on the ambulance first and foremost. Because if the people on the ambulance don't even understand what AI is, how will they use it? And do they have the facility and the technology within the country? How many regions in the country have 5G connection and are able to integrate this? And the individual that's on the ambulance, who is on the, how about we focus on the basics? How about we ensure that the ambulance has staff that are trained to let's say, for instance, a degree level or a diploma level instead of having the driver system. People that can actually use this technology and understand its application instead of us just doing, spending money into resources, putting them onto the ambulance, and then people are unable to use it. So we have to understand who's going to be using this and what for. For instance, is this person going to be using it to send information through to doctors that are in, let's say, for instance, this person is in Rundu, they're going to be sending this to Bentu, there's a doctor. Do they understand how to use the technology? If you give a gentleman an iPad, does he know how to use, let's say, a dispatching system to make sure that, okay, I have an ECG here, I take a picture of it and I'm going to send it to the doctor. Will it get through? Is there a system in place that can integrate this? So I think we need to start off with basics. Let's just have a system in the ambulance where we just do the basics. The basics are we have an ambulance that is available when necessary all the time, 24/7, with qualified professionals on it that can respond to emergencies and ensure that they meet the needs of our people. I think we should focus on basics and let's not even speak about augmented reality. That is something that not even London Ambulance Service itself spends billions. And I'm speaking about London Ambulance Service would use something once and dispose it. We are still in the system of one, it's either we do not have it or we are recycling it. So I think that is very far from us. And this is something that is very close to my heart. I'm passionate about it. We have a podcast of paramedics where we are understanding the emergency medical care systems in Africa. And we understand. And I think I can tell you that one of the leading professions or systems are in South Africa, but they're not even thinking about augmented reality. They are thinking about how do we get a system where if you go to the hospital, you register and a doctor can pull up your details and see that you were seen 6 weeks ago because you came in with a painful tummy and you got this medication, but now you're coming back with the same problem and continuity of care can proceed. So how about we get those things in place and integrate on top of that when we have those basics in place?
Now, the minister also spoke about real-time data transmission, and you also spoke about it now, and remote guidance from doctors to improve paramedics' ability to treat patients in transit. Is it something that's possible?
It definitely it is possible, but it's not something that we should be focusing on. I think And all respect to the Minister of Health, but I think she needs to connect with the people. I would kindly advocate for her to either first, if she is happy to chat to us on the Para podcast. We recently covered a podcast about the EMS in Kenya and how Dr. Wachira, who's the emergency physician there, has transformed the EMS service in Kenya. He made sure that there's an ambulance number to call. There's at least an operational ambulance within one county that can respond to the emergencies. There are emergency centers that are operating 24/7. The people that are working there are trained. So we understand what it means to raise an emergency medical care system within a country. We have that experience. We'd like to check where we can give her pointers. If not, she can go to Namibia University of Science and Technology. There's a department that trains paramedics. It's a 3-year degree. Most of the paramedics there are working in London. Some of them are working in Qatar. Some of them are working on the cruise ships. They are very experienced individuals. Motor Vehicle Accident Fund of Namibia has ambulance systems that have been running at least for the past 7-8 years. So you can get guidance on what is possible. I think where we are looking is too far. I think we should focus on the basics. I think it would be good. It would be good in the sense that doctors can communicate to paramedics. But the problem is we don't even have paramedics on the ambulance at the same time. Obviously, that comes to the nuances of understanding the qualifications that are on the ambulance. You have a basic life support, you have an intermediate, and then you have an emergency care technician, and then you have your degree qualified individual, which is the paramedic. As a country, we should ensure that all our ambulances have at least up to an intermediate level. Let's give the basic care to our people. Someone cannot be dying in Congo because an ambulance takes 7 hours to get to them. They should be getting an ambulance within the first 10 minutes if they call with chest pain. Those are the things that we should be focusing on.
Now, Thomas, with the procurement of 36 ambulances valued at 32 million Namibian dollars, the minister emphasized the importance of maintenance. Now, from your experience, how does poor maintenance affect paramedic work and patient care?
Well, it's one of those that can constrain a system, because if you buy 36 ambulances or so and you do not maintain them very well, they'll start falling apart. We recently covered on our podcast one of the ambulance systems that were in Zimbabwe. And we're chatting to the prior CEO of the Emergency Medical Care Response in Harare. And he was speaking to us about how they had about 200 ambulances. And as of 2018, I would like to think they had 5 ambulances. That just speaks to how maintenance is very important. Because if an ambulance, I don't know, for whatever reason, something happens to it, there must be an in-house servicing unit that ensures that that ambulance within 48 hours is ready to go back onto the road, and there must be a replacement for it. But now, it's also very important to have a decent structure. You need to have, for every base, this base is where the ambulances are operating from, there needs to be a manager that oversees how the resources are used, that ensures that if an ambulance is broken, he relays with the department that's responsible for fixing the cars of that specific EMS system to ensure that this vehicle is back in operation within 48 hours and nothing is stolen from the ambulance. So having that structure that oversees how the resources are being used and when a resource is defective and when it can get back into service is very important. So it's systems. We do not have those systems in government, even though we do have them. And I speak under correction because I've been out of the country for about 3 years now. But I am aware, I do speak to the people on the ground. There is no system. We need to focus on the system. And this is my recommendation. Let's start off with establishing one base. This base is going to have people that are going to work 24 hours, come on shift, off shift, rotating, making sure that the shift is covered at all times. And then having a base manager that oversees how the operations are going and that the staff are supported adequately and they respond to emergencies that are required and you maintain the quality. Once we graduate from that, we can stretch out to a second base, which we can even establish in Ochibarongo, for instance. So every other coordination from the rural facilities will be coordinated in that manner. And then we can expand to the rest of the country. But we have to pilot this. But we can start in one location and expand out as we go.
Now, Thomas, being a paramedic with a vast experience, not only here in Namibia, but also in other places abroad, what would you say the ministry should prioritize now on in terms of emergency medical care?
So the most important thing is understanding what you have on the ground. It's very important for her or the ministry and her team to put together all the professionals. And I can guarantee you, if she needs my help, I'm happy to do that for free. No, no. We need to put together a team of individuals. These well experienced medics that understand the ambulance system, right? And then we need to understand what do we have on the ground. Do we have an like emergency contact number? If, for instance, now, if you fall, not let's not talk about if you get run over by a car because NDA fund covers that. But if you start feeling like you are not well today and you do not have medical cover, who do you call? What do you call? Is there a number that you call? I'm gonna guess that your answer is gonna be no.
Yes.
But how about the person that is in Okuriangava or Omdili that is not feeling well and they're in their room? Who do they call? Do they jump into a taxi? How about we ensure that there is a number that they can call to say that I do not feel well, I need to go to the hospital, these are my symptoms, and qualified paramedics can come to this person. Treatment can start on scene, en route to the hospital. The paramedics can hand over to the doctor, and they can record all the management and so forth into a system. Let's get the system in place. So a system to say that we have a well-functional ambulance service equipped with experience or sort of like suitably trained professionals that perform quality work and ensure that the needs of the people are met, and hand over to a system that understands what's happening in the pre-hospital setting. So I think we need to coordinate that space. And this is why I'm saying there are very important role players here. City of Bentuk has been doing it for a very long time. They understand a little bit of what's happening. And the Namibia University of Science and Technology is training the professionals. We need to join ventures with others and also other private companies so that we can make sure that we can learn from their experiences, because they've been doing this in the country for a very long time. And then we integrate our system and make sure that we have a system that works for our people. We need to care for our people and ensure that they understand that the system is there for them.
Absolutely. Thomas, thank you so much for making time for us right here on the Reading News Bulletin and sharing the insights with us.
Thank you. No, I do appreciate it. I'm just gonna say to the ministry again. Honestly, we as the international cohort of paramedics that have been working everywhere, we are ready to assist the ministry. We really want to change things in our own country because we see what's happening on the outside, and we really like to contribute.
Absolutely.